Or let's do it. Okay, guys. Today's going to be, I think, pretty cool because we're transitioning from the lower extremity to the upper extremity. And there's pros and cons that come with that transition. However, I want you to know that every new topic we have, there's precedent. There's lower extremity precedent. And the upper extremity is different, but there are some similarities. So it's like there's nothing that we're going to cover for the next couple of weeks that's going to just be out of left field new. It's a little different because our upper extremity has different functional tasks than our lower extremity, but they're very similar. Wrists, ankles, elbows, knees, hips, shoulders, scapula, pelvic girdle. So that's going to be the transition for today. Stating that transition, let's take a look at this picture. Anybody know who this actor is? Jean-Claude Van Damme. Yeah. And he was a martial arts actor. Didn't know martial arts. He was actually a dance theater major who was very, very flexible. And in movie training, he's a martial arts. Like he couldn't compete in MMA stuff. He said it himself. But incredible martial art movements that he was able to do for film. So let's take a look at his positions. You say, wow, he's able to get his top leg. I mean, obviously it's not 180, but it's a lot higher than what a normal person might be able to raise their leg, okay? So let's take a look at how Jean-Claude would get his leg so high globally. Because he could plop down and do a split, but it's like doing a split with one foot on the ground. So his left hip is going to abduct. You see that? His pelvic girdle, because they're not independent parts, is going to have left lateral pelvic girdle rotation. And what that's going to do is literally raise the entire right leg, reposition the right leg clock so that the clock hand can carry that over and be at an almost vertical position. Meaning something like this. Not exactly like this, but something like this. Unfortunately, I was not born an octopus. So I'm going to do these one piece at a time. So this is what he did. He did this, and the right side has to go along with the left side. And then once he was here, then he could do it's a metaphor for life. Then he could do, once he was here, then he could do that. Yay! You see what I'm saying? Okay. Now, unlike a squat in the ground where your base of support is all over your center of mass, he has to maintain his center of mass over his base of support in that one foot. Meaning, it doesn't matter how strong you are. It's physics. He's not grabbing on anything. If any of his mass tipped over his base of support, he'd fall over. So it's like if you were standing here, if you were just standing here and your pelvis didn't kind of reposition to try to get your mass over your foot that's on the ground, you would just fall over. And look at his trunk. Let's practice trunk position. How do you think he is leaning? To his right or to his left? To the right. Good. Right lateral bend, which again makes sense. If he's trying to keep his mass over his foot, he wouldn't want to go this way. He might fall over to his left. But you can see how his right shoulder is closer to his right hip relative to his left shoulder to his left hip. Do you see it? What about his cervical? Is his cervical bent? How? To the right. To the right. To the right. To the right. Now did. Does everybody see how we can see these things? And for him, not only does he want to keep his eyes level, but again, he wants to keep as much mass over his base of support as possible, because if he brings too much mass away, he's going to fall over. All right. So that being said, let's transition to upper extremities version of scapular and hips, pelvis and hips. So you have your pelvic girdle, which is a cemented, but it's more stable down here, right? The block can't move my right and left independently. But when we come up here, our scapula, our shoulder girdle is much different. There is no connecting right and left side. They are independent of each other. I can move my right scapula independently from my left, and that creates different rules. But the functionality of having scapula to shoulder is very similar to what we just went over with hip to pelvis, meaning my scapula helps my functional circle of reach and work. Example, if I were just to flex my shoulders only, this would be my reach. Feel like a T-Rex. Guys, this is all extra scapular motion. It gives my hands to reach a little bit further, reach a little bit higher, rotate my clock a little bit more. So in other words, when we say 180 degrees of abduction, we're going to get into more detail, but your clock hand does not do this. It can't. What your clock hand does is this, and your scapula does that. Just like we did on the kick, how the pelvis helps reposition the foot to get higher. It's very similar. I'm going to show you how the scapula helps reposition our shoulder to get more functioning. But unlike the pelvis, where they have to go together, if I wanted to reach my left foot more forward when I walk, I have to transverse pelvic girdle rotate. I have to have right hip internal rotation in order to swing my left side more forward so I can take a bigger step. I don't have to do that with these. I don't have to make my right scapula go back so that my left goes forward. Let's see if I can do this. Get some concentration. I don't have to do this. I can just do them independently. But it's similar. It's similar. It's just they don't have to go together. They don't have to move together. They can move independent, but it's similar. Hiking this side up because there's some functional reason to do so. Hiking this side down because there's some functional reason to do so. It's just they don't have to happen at the same time. They can happen independently, but it is similar. Helping my functional circle of reach, helping me reach back just a little bit more than what I could have with my shoulder alone, helping me reach forward just a little bit more if I would have just used my shoulder alone, helping me rotate just a little bit higher than if what I would have used my shoulder alone. So what I did is the scapula is usually the toughest thing to see. So I pulled up a little video. These are available, for you to find. This is Muscles in Motion. Guys, there's a lot of the concepts are the same, but sometimes people will call different things different things. That's perfectly okay. The polar axis to some university may be the longitudinal axis. It's the same concept, but cat minute. We just need to make sure we are on the same page of what we call it. Okay? So the first thing you'll see is ab and adduction of the scapula. Some people refer to it like that. Where I went to school, we preferred retraction and protraction of the scapula. I'm going to explain why, and I'm going to explain how that just kind of functionally works. Then we're going to talk about elevation and depression of the scapula, and then upward and downward rotation of the scapula. But all of those motions have something in common. It's the scapula functioning like a pelvic girdle for my upper extremity, independently working to help my functional circle of reach. Helping me reach a little bit further, a little bit more across, a little bit further back, a little bit higher up, a little bit further down. So let's take a look at these motions. So this is what we're going to call retraction, and this is what we're going to call protraction. You think about retracting the bow and arrow, like if you were going to retract a bow. So my arms represent the bow, and you retract when you string it, and you do that fancy little step across. You retract the bow. So my scapula would be retracting. And then you think about progress, moving forward. Protraction would be the scapula rounding forward. The key thing is that when the scapula is moving about the thorax, that's why they call it the scapulothoracic articulation. It's kind of like, these are anchored down so I can't move them, but the scapula is almost kind of like it's orbiting the ribs. It's kind of orbiting. Think about the heart being the sun, and the scapula is kind of orbiting the ribs. Pelvis doesn't have to do that. So in other words, the scapula can't go truly straight. It has to orbit. It has to curve around the curvature of the ribs. It has to curve around the rib cage. Okay. So we're going to have protraction and retraction, which is a great function to help me go a little bit further back or a little bit more forward. We're going to have elevation and depression. So notice, my pelvis can't just do the same thing. My pelvis had to do oppositions, right? So elevation and depression is when the scapula helps me get up a little bit higher or a little bit lower. That could be with my hand up in the air, a little bit higher, a little bit lower, a little bit higher, a little bit lower. Or if you're holding something, a little bit higher, a little bit lower, reaching down, pulling up, that scapula. And everything's attached to the scapula goes along for the ride. So if you're holding like a bucket, right? The bucket's trying to depress you. But if you don't want to knock over something, you may elevate your scapula to bring it up a little bit. Here's a key point. I'm going to hold that key point and do the last motions that you're accounting. Upward and downward rotation. These functional tasks of our scapula help get our humerus over our head completely. So we have a concept called glenosscapular. I've had a break too long. Scapular humeral rhythm. Tongue twister. All that is how much does the scapula contribute and how much does the glenohumeral joint contribute to getting my hand over my neck? That's all that means. So here's my arm at my side, 6 o'clock. My shoulder joint cannot go to 12 by itself. I do not have 180 degrees of motion at my shoulder joint. My shoulder has about 120 by itself, and my scapula has about 30 degrees of literally spinning the clock, repositioning the clock so that my hand could go over my head. Pretty cool. You feel it? Yeah? It's okay to feel your scapula. It's pretty cool. Okay? Grace. Let me see one second. Grace is going to be my subject. Good morning, Grace. How are you doing? I have a shirt like that, but it says New Iberia. Okay. So watch this. Okay. Have you heard this show before? Okay. So what I'm going to do is I'm going to apply a little pressure to make sure her scapula stays down. Okay. Now what I want you to do is slowly abduct your shoulder. Slowly bring it up. Now go as high as you can. Big difference, huh? Okay, one more time. So I'm preventing her scapula from helping. Cool. 5 people love you, Grace. They're so shy. They're so shy. She's been a big help. She's been a big help. So the scapula, I'm going to get straight to a question that we ask that unfortunately, a lot of you guys are going to miss. Not a lot of you guys, but a lot of students that just don't study. They don't look at the material. They don't take stars of what we tell you to take note of. Knowing what you know now, if I take dumbbells and I do this, am I doing shoulder movement? What movement am I doing? Scapula. So people call them shoulder shrugs, insinuating shoulder movement. But the shoulder can only do what the hip can do. It can flex and extend, it can have an adduct, it can internally and externally rotate. What my shoulder can't do is dislocate from its socket and go up and down, and then when you're done, reduce itself and be like, okay, we're good. In addition, your shoulder joint is arbitrarily going up and down, just like your elbow joint is arbitrarily going up and down. So next time you're doing these with friends, say, hey, can I get in a set of those elbow shrugs? It's the same thing. Your elbows are going up and down. Your wrists are going up and down. Call them wrist shrugs. Phalangeal shrugs has a great sound to it. It's because we're linear thinkers. And it's like, oh, the shoulders are going up and down, so there must be motion at the shoulder. Scapula elevation, depression. Scapula elevation, scapula depression. Cool? All right. So, if you follow in your Moodle notes, there are 4 articulations of each shoulder girdle. Your sternoclavicular joint, right? Where this happens. Fun fact, this is actually the place where your upper extremity connects to your thorax. Right here. So when you're elevating and pressing, your clavicle, as attached to your sternum, is doing this. You go forward and back, it's doing this. And when you go up, there is some rotation that happens between the second joint I'm about to talk about, your sternoclavicular, your acromioclavicular. So your acromion is this bill cap hooked area of your scapula. It's called the acromion. So remember, we talked about this for our lower extremity. You have a femur, you have a tibia, you have a fibula, but you can have areas of the state, areas of bone. Acadian is an area of Louisiana. It's not a separate state, it's just an area. So the acromion isn't a separate bone, it's just an area of this flat bone called the scapula. Sometimes when we name these things, not me, I wasn't around, you don't want to have redundancy. In other words, some bones articulate with multiple other bones. So we don't want to say like scapular clavicular when we already have a scapulothoracic. It's kind of how that works. Like if you have one bone that articulates with multiple bones, it's common for them to talk about the area of the bone that's articulating if something has already claimed right to the bone itself. Sternoclavicular, acromioclavicular. Anybody ever have or hear about an AC joint sprain? AC joint just falling. Bang, direct hit. When you move your scapula, these two bones are rotating about each other to help reposition. That hurts. I had one of those way back in the day. The third joint is the one we're familiar with, the glenohumeral joint, the shoulder joint. The glenoid fossa, again, that's part of the scapula. Well, why do we call it the scapulohumeral joint? Well, because again, scapula is used for the thoracic articulation, so we're going to use an area called the glenoid fossa. And the glenoid fossa is just the little T, the socket of the shoulder. Well, Dr. Campbell, I heard the shoulder doesn't have a socket. It does, it's just not very big. Is a golf tee a socket? It's just not very big, but it's still a socket. It's still a socket. It's just not very big. Now, this socket gets accentuated with something we call a labrum. I've heard of that before, right? A labrum. You know what that is? All it is a suction cup. It's a suction cup. You put a you put it on your mirror. All it is, the labrum is a suction cup that helps accentuate the socket. It makes the socket deeper and bigger, and it provides what we call negative pressure. That's what a suction is. It's negative pressure. That's why when you tear your labrum, that shoulder feels unstable because you pop that, you created, you punched a hole, and now all of a sudden that air and fluid, and it loses its suctionness. It's created a word there, but I think you understand. So we have our glenohumeral joint. This is our shoulder joint. This is the one that's going to mimic the hip in all ways. Every motion is going to be the exact same. It might look different globally, but it's the exact same frontally. If this was hip flexion, this is going to be shoulder flexion. Extension, add, external, internal. Glenohumeral joint. And then the last joint is the scapulothoracic articulation. Scapulothoracic articulation. That's kind of different. Which one doesn't belong? Apple, banana, strawberry, sledgehammer. Sternoclavicular joint, acromioclavicular joint, glenohumeral joint. All these things have capsules, fluid, synovial fluid, but the scapulothoracic articulation is literally how the scapula floats and orbits about the trunk. There is negative pressure there and muscles that help to stabilize it, but it's not like a traditional synovial joint. How many of you ever seen someone do that party trick where they reach back and they can take their scapula and winging scapula? Scapula have wingy. I can't do that with other joints. Okay, check out my knee. So it's just floating there, and it's held together on your thorax with suction cup pressure and muscles, but that is variable to different people. When we talk about scapular motion, that's the part we're looking at. So even though there's motion here, we're not looking at sternoclavicular protraction and retraction. Because the muscles that are influencing all of these muscle or motions are pulling on the scapula. That big flat scapula has a lot of anchorage and muscles that are pulling in these directions. That makes sense? So when we talk about scapular, so let's look at it one more time, knowing what we know now. We're going to say, all right, bilateral scapular retraction, bilateral scapula protraction, bilateral scapula elevation, bilateral scapula depression, bilateral scapula upward rotation, bilateral scapular downward rotation. Okay. Someone other than Grace wants to be a volunteer, and I'm going to show you through the back of your shirt. As you raise your arm, I'm going to mimic your scapula. And sometimes when people volunteer and you feel it, you're like, oh yeah, I feel that or see that. Does anybody want to be my volunteer as I show everybody how your scapula is moving through a range of motion? Anybody? Come on. Come on. Come on. You don't want to over here. So what we're going to do is stand to the side. Perfect. Okay. Left scapula, right scapula. So let's first go elevation. Let's go up and down. Now just the left. See, the right doesn't have to do anything. They're independent, right? Let's go retraction. Let's go back, forward. Okay, back to anatomical rest. Just the left. Left retraction. Right doesn't have to do anything. Now this is the fun part. Let's slowly abduct our shoulder out to the side. Good. See it? More time. Now watch. You hurt your shoulders before. Okay. I'm going to suppress. I'm going to make sure the scapula doesn't move. And slowly, just don't make me look. Slowly abduct your shoulders. And I'll go all the way up. Cool, huh?
Okay, yeah,
That's weird.
yeah.
But that's how much, the lesson is, that's how much your scapula contributes by repositioning the actual clock. The scapula is the clock. The shoulder's the clock hand. So when we did abduction, we went like say to here, like say we went 90, but I didn't let your clock turn. And then when I let it go, your clock did that. Does that make sense? Does that make sense? There was one time I was, I try not to be that guy, but every now and then, I guess you got to be that person. But I was at a conference, and this person was trying to sell, some snake oil, or I think it was holograms or something. And he actually used that technique as an illusionary, as basically a trick. So he said, let me check your range of motion. And I had 3 friends with me. They were phys guys. I was the biomechanics guy. And he actually stood in front of my shoulder so they really couldn't see. And they're like, okay, bring your arm to the side. And I knew he was suppressing the scapula, and I was only able to get to there. And then he was like, okay, now I'm going to put this hologram in your pocket. It's going to refocus your energies, and it's going to do this and this. And he's like, okay, now bring your hand up. And then he let go. I was able to bring my arm up. He was like, what do you think? And I was like, do you really want to know what I think? Fun times. It's hard to see, but it's easier to feel. It really is. So what I want us to try to do, we don't have to get up, but if you can suppress your own scapula, meaning take your right or your left hand and consciously push your scapula down and say, scapula, stay. And then try to bring your arm out to the side and see how far you bring your arm out before your scapula wants to help. Doesn't take too much time. If you keep your scapula depressed, you're not getting your arm out very far. Pretty cool. Okay? So the importance of scapula. Now, there is a similarity to elevation and upward and downward rotation. There's a similarity. However, I can upwardly rotate my scapula to help reposition over 180, and then from here I can elevate and depress. So they're not the same, but there's a similarity. Trying to get my hand as high as possible requires 2 things. Rotationally, I have to get to 12, and then linearly I can have some elevation to get as high as I can. Just doing this isn't going to help get the cookie jar out of the pantry. I have to rotate my clock hand, then I can raise my clock. So on the test, the way we're going to make sure we differentiate those is that when I'm asking a upward or downward rotation question, it's always going to be associated with shoulder motion. The clock will always be associated with the clock hand. Meaning, if I'm going to ask you to identify upward or downward rotation, there's going to be some shoulder motion with it. Whether bringing it up, bringing it out. The same thing happens. Flexion or lateral flexion. The scapula is going to upwardly rotate. Let me show you another visual, because I just want to make sure this concept is very important to get. MVP class. Ken. Ken is the shoulder joint. Well, he's not the shoulder joint. He's the humerus. Head of the humerus. My articulating surface of the humerus. This is Ken, this part. Let me make it more real. So that way, make sense? Okay. my fingers are going to form the glenoid fossa, the little socket that the shoulder comes up to. Okay. Here's what I want to show you. If all Ken did was move by himself, he would be about right here. The scapula is going to rotate to reposition the socket, to make the socket, instead of vertical, to put the socket at an angle so that you still have 180 degrees of shoulder motion. The socket is, it's no different than I'm at 90 degrees at my shoulder, but if I lean to the right, my arm goes higher. I didn't move my shoulder, I bent my trunk. It's the same concept. You have so much of this, and then by upwardly rotating the scapula, you reposition the entire thing so that you can get your hand over your head. Make sense? So, there are going to be some illusions that we're going to get to, but the concept is the same. If your arms are going up, whether that's sagittal, frontal, or a combination, your scapula is going to upwardly rotate to help reposition the socket. And if your arms are coming down, whether that's sagittal, frontal, or a combination, your scapula is going to downwardly rotate. Good rule of thumb. Campbell, what are illusions? What are we talking about? Illusions. What are these illusions? Some of these, well, a lot of these exercises have linear cues in the names. So something like this. The worst possible. Okay, so what do I mean? So this exercise is called a lat pull down. And when we come down, if we're looking at sagittal movement, we're going to have shoulder extension. I can say that because we had that on our first test. I'm not going to use the ab and the ab, but we're going to have shoulder extension, or have elbow flexion. But because we're bringing our arm down, the scapula is going to downwardly rotate. Okay. When we go up, the scapula is going to upwardly rotate to go with our shoulder flexion. That looks like it's moving, and it is. And then we have this exercise called pull up. Now, what Campbell is not saying is, Campbell says we should rename every dang exercise. No, we need to be aware that the motions of the pull down and the pull up look different globally, but they are the exact same locally. See if I get a similar picture. See if I could find it another under 15 seconds. So in other words, notice our start position. When he starts, his shoulders are already flexed. His scapula is already upwardly rotated. So as he pulls himself up, the scapula will actually be rotating down. Make sense? But our brains are going to be like, well, I'm doing a pull up, so it must be upward rotation of the scapula. You see how those things can kind of mess with our brains? So this would be shoulder extension, elbow flexion, and downward rotation of our scapula. There's some other stuff happening here too, but I wanted to just make the point that we can't say pull up. So when I'm pulling myself up, scapula must be downwardly rotating, upwardly rotating because of up. In other words, the lat pull down has the same motions as when you pull yourself up. That's the so what. Something with the word down has the same motions as something with the word up because of the cap in the bottle, right? Because of the illusioners. Here's another example of an illusion. Like if somebody was, I may have to demonstrate it. I'm going to just demonstrate it. I'm glad that's appropriate there. Just never know. Okay, so if we look at, it looks like it's moving, and it is. That's how all of our joint motions are really named, because of the most common way for something to move is the small piece moving above the big piece. So we learn these motions like protraction and retraction, protraction and retraction. But it can also look, when we fix the distal part and move the proximal part, protraction and retraction can look something like this. Protraction, retraction. In other words, you see me going back, but it's because my scapula went forward. See if I could do it like this, okay? Okay. Protract. Retract. Protract. Retract. Protract. Retract. We don't want to say, oh, something went back, so it must be this. Something went forward, so it must be that. We want to look at the joint. Where is that joint at? Where is that joint at now? We have to understand that I can move small pieces about big pieces, the piece on the board. But in human movement, I can move the board about the piece. And if I get to the same place, I have to call it the same motion. Even though the board on the Monopoly game went back, my piece went forward relative to the things that make up the piece in the board. Same thing with our joints. All right, Grace, what we'll do is we will have about 5 or 10 minutes of working lab for the students that came to class. And students that are watching or rewatching for the first time, come to office hours, contact Grace and myself. If you want to do some in-person movement practice, come see us. What I would like is, first, let's take a few minutes to work on our elevation and depression. Make sure we know that I can do left elevation, depression, right elevation, depression, or I could do bilateral. And all this is our upper extremities version of our pelvis doing this. But the pelvis has to do it together. The scapula can do it independent. Okay? So we'll start off with elevation and depression. Make sure we got that. Protraction and retraction. Make sure we do that. And we can even do illusions. You don't have to get on the ground. You could do it in the wall. You could do some wall practice. And then if we have a few minutes, we can do what we did and just kind of practice seeing how your scapula, it just makes sense. If I'm going to try to get my hands over my arms, the scapula is going to have to upwardly rotate to reposition the socket to do so. Ken does not have enough articulating surface to go all the way up. Like the actual ball of the humerus, there's not enough articulating surface for him to go all the way here, like I know this isn't in real life, but like Ken's articulating surface is just like his mouth and his nose. So the scapula has to do this in order to get him over the top. All right, let's back. All right, do me a favor. On the count of three. 1, 2, 3. Stand up. Everybody stand up. I think it'll just be a lot easier, and nobody wants to be the first. I get it. Grace, let's float around and answer anybody's questions. Somebody did like this. Somebody was stretching. Yeah, that would be retracting. Stretching your protraction pullers, but you'd be retracting your scapula. Retract.
No, yeah, for sure.
Fly. Oh, literally. It's going to be tempting, but don't put shoulder. I know it's going to be tempting, and I'm telling you it's coming. They're going to say, what's this? And about 30% of the class is going to say shoulder elevation. It's tempting. Okay, so let's get into the habit. So you know, this is one of the up. Are you taking again, this should be probably not. No. That's probably you are self as you feel there. They're the time busy before the show. This finish. So that's all I do my second and try second long. Is there literally 15 errors, you know? All right, guys, one more practice question. How about this? Next time you're doing dips, let's see if I could do this. Answer is probably not. Next time you're doing dips, just for practice, what would this be, and what would this be? Is it? There is nowhere. Maybe. That's how you learn. You know what? You know what's cool? I'd much rather get it right on the test. Cares. That's how we learn. So start. I'm here. Finish. I'm here. So I started here and I did this. Your brain sees my body going up and down. That's not what elevation depression is. It's my scapula relative to my thorax. So this is another example of the illusion. This is depression. This is Elvis. Good? Did we learn some cool stuff today? Yeah. All right, guys. We'll see you on Friday. That's right.